Assistive devices for eating and feeding. Welcome to our learning module on assistive devices used in feeding and eating. During this module, you will learn about types of assistive devices used for feeding and eating, how to assist patients to eat using assistive devices. Let's start by reviewing some terms that we'll use throughout this module. Occupational therapist, a healthcare professional that assists patients in finding ways to perform everyday tasks while living with health challenges. Adaptive, a word used to describe devices that assist patients with difficulty performing tasks to do so more easily. Utensils, spoons, forks, or knives used for eating. As a caregiver, you may notice that your patient has challenges eating independently. This may be due to decreased strength, swallowing difficulties, or trouble holding utensils. Using assistive devices for feeding and eating can greatly improve your patient's independence and quality of life. Let's start by looking at some common types of assistive devices used for feeding and eating. Adaptive utensils. These utensils are specially designed to be easier to hold and use for patients who have difficulty with their hands or grip strength. They have bigger handles, angled or weighted designs, and grips that are built up to make them easier to use. A patient can use their own utensils by placing them into weighted holders. These holders can also be used for razors and toothbrushes. Plate guards or plate retainers. Plate guards are attachments made of plastic or metal that can be put on the edge of a plate. They prevent food from falling off the plate while the patient eats. Patients who have a hard time coordinating their movements or have shaky hands can use them to scoop food onto their utensils more easily. Non-slip mats. Non-slip mats can be placed under plates, bowls, or cups to keep them from sliding around the table during mealtime. This helps patients with limited mobility or hand control keep their tableware steady while eating. Feeding cups. Feeding cups are designed to help patients with limited hand control or difficulty swallowing to drink on their own. They have features like larger handles, spout lids, or angled designs to make them easier to hold. The lids are designed to prevent spills if dropped, and the spout slows the flow of liquid for patients who need extra time to swallow. Swivel trays. Swivel trays can be easily attached to wheelchairs or armchairs. They provide a stable surface for patients with mobility limitations. Swivel trays make it easier for patients to reach their food and enjoy their meals. Electric food processors. Electric food processors can be used to puree or grind solid foods into a smooth consistency. Patients with swallowing or chewing difficulties may require altered diets. Food processors make it easier to prepare the correct texture so patients can safely consume their meals. Always follow the diet orders given by the patient's healthcare team. For more information on different types of diets, see our module on eating. Sippy lids. Sippy lids are special tops that can be put on regular cups or glasses to make them spill-proof. The cups are helpful for patients who struggle to control their hands, making it easier for them to grip and drink from the cup. When determining which assistive devices to use for your patient, remember that the specific devices needed can vary depending on a patient's individual needs and abilities. Consult with the healthcare team or occupational therapist for personalized recommendations. Feeding tubes. Another special assistive device is a feeding tube. Patients who have difficulty swallowing or cannot eat normally may have a tube inserted by a provider through their abdomen into their stomach. These tubes provide liquid nutrition directly to the stomach or small intestine so that the patient receives the necessary nutrients. There are several types of feeding tubes, some entering through the nose or mouth and down into the stomach, and some entering through a hole in the belly. The tube allows a caregiver to pass liquid through the tube and directly into a patient's stomach. If your patient has a feeding tube, there are some things you need to keep in mind. Never remove the patient's feeding tube. If the tube appears to have become dislodged or removed, notify the healthcare team right away. Never try to push the tube back in. Always follow the healthcare team's orders and directions carefully for placing fluids into the tube. Only insert ordered fluids into the tube. Some patients may have orders that allow them to eat or drink in addition to what is entered through the tube, while others may have orders prohibiting it. Follow all these orders carefully. If your patient has a tube that has been inserted through their belly, monitor the insertion site for any signs of infection, such as redness, swelling, foul odor, or discharge. For patients with a tube inserted through the belly, caregivers must keep the insertion site clean at all times. Make sure you wash your hands and wear clean gloves as you gently clean around the site with a clean gauze and gentle cleanser recommended by the healthcare team. Notify the healthcare team if your patient reports feeling nauseous, begins vomiting, or has pain in their stomach or belly. Notify the healthcare team if your patient goes more than 2 days without a bowel movement. How to help a patient with meals using assistive devices. Next, let's discuss how to help a patient with meals using assistive devices. Using assistive devices for feeding and eating can greatly improve a patient's independence and overall well-being. Here are some guidelines to effectively assist patients. Assess the patient's needs. When helping a patient with a device, it's important to first understand their specific needs and abilities. Consider things like how well they can move their hands, how strong their grip is, how easily they can swallow, and any other physical limitations they may have. Choose the right device. To find the right assistive device for a patient who has trouble eating, talk to their healthcare team or occupational therapist. They can give advice based on the patient's specific needs. Familiarize yourself with the device. Take the time to read the instructions or watch instructional videos that come with the assistive device. Understand how it works, its features, and any safety precautions that need to be followed. Provide a comfortable environment. Create a comfortable and supportive environment for mealtime. Make sure the patient is supported appropriately with proper back support and a stable tray or table. Demonstrate and explain. Show the patient how to use the assistive device by demonstrating its proper use. Use clear and simple language to explain each step involved in using the device. Encourage independence. Encourage the patient to use the device by themselves as much as possible. If needed, give them verbal cues or reminders, but allow them to practice using them independently. Be patient and supportive. Using devices that help with tasks may require practice by both caregivers and patients. Be patient, supportive, and encouraging throughout the process. Remind patients who have difficulty swallowing to chew food slowly and swallow between bites. Regular maintenance. Make sure assistive devices are kept clean and in good working condition. Follow any cleaning or maintenance instructions provided by the manufacturer. Monitor progress. Regularly check how well the patient is using the assistive device. Pay attention to their comfort, how much they eat, and any problems they're experiencing. If necessary, make changes or get help from the healthcare team. To learn more about how to properly feed your patient, see our module on eating. Each patient is different, and their needs may change over time. Pay attention to your patient's needs and make any adjustments to the use of assistive devices. This allows for the best outcomes for patients. Thank you for attending our learning module on assistive devices for feeding and eating. We hope you've gained a deeper understanding of how to help your patient use assistive devices.